I thought I went there to be kept safe.
And I'd learn new ways to self-harm.
I don't feel they made me any better. I think they made me a lot worse.
Tyson, Alice, Amber, you may remember some of the young people who've spoken to Sky News in recent months. Over 50 former patients who've raised serious allegations about the way they were treated in mental health units run by a single provider and paid for by the NHS. Now those involved in the care of patients have spoken to Sky News. Callum is one of 2 former workers who claim patient safety was compromised because of inadequate staffing and training.
There was a lot of incidents that could have been avoided. There were a lot of patients who maybe caused significant harm to themselves, which could have been avoided had we had more staff.
Callum worked at this unit in Maidenhead in Berkshire, run by the Huntercombe Group, now part of Active Care Group. A place for young people who needed specialist intervention for serious mental health conditions, and many of whom couldn't be left alone.
Patients had a difficult time gaining access to the garden because they required a staff member to go with them, and even using the toilet.
What did you think about that when you had to tell people, no, you can't go to the toilet because we don't have a member of staff to supervise you?
Of course, I felt bad. I felt horrendous.
Callum says his last full shift was in February last year after being given a warning for taking an unauthorised break. He says staff weren't able to have proper breaks. He later resigned.
There were a lot of staff there that really did care. Obviously, when we were below numbers, which was more often than not, that made it very challenging. It made it very difficult.
A second former worker corroborated concerns about patients being left at risk because of staff shortages. And union official David McMullen told us he's been representing staff at the Maidenhead unit for the last 7 years.
It always stood out as a problem workplace when we compared it with other care homes and similar employers. There was always more issues there, but I think over the last year that has massively escalated.
Active Care Group took over the Huntercombe Group in December 2021. A spokesperson said, these unconfirmed accusations undermine the tremendous efforts being made by current employees to support those in their care at Taplow Manor. These allegations have been made by 2 junior former members of staff, one of whom was subject to disciplinary action. Neither has worked at the hospital for a year. Staffing at Taplow Manor is monitored daily and the shifts are fully staffed, often with an additional 2 to 3 workers on every shift, as well as therapists, doctors, teachers, nurses and ward managers. Previous owners Ellie Investments Group said it regrets care services failed to meet expected standards. The latest report from the regulator, the Care Quality Commission, published in August 2022, found Taplow Manor had enough nursing and support staff to keep children and young people safe, but the hospital's overall safety rating was inadequate. A police investigation into the death of a patient in February last year is ongoing. This week, the government announced a rapid review into inpatient mental health services in England. Lisa Holland, Sky News.